Hello, welcome to another episode of Black Ice 73. I am Black Ice 73. I told y'all last month when I did the video on Johnson Johnson, do not mess with them. But first of all, I'd like to say happy 18th birthday to my younger daughter, Black Ice 2003. Today my daughter turned 18 and I'm so happy for her. She'll be going to college this fall, so I'm gonna have a little family dinner for her today. But I told you all last month, I said, hey, it's Johnson and Johnson people. Johnson and Johnson, they're in the middle of a doing lawsuit. Johnson and Johnson, they're getting sued for getting on women ovarian cancer, but not ovarian cancer, ovarian cancer. And I said, don't fool with Johnson and Johnson. They got too much junk going on. Come out today. The CDC and the FDA said, I recommend y'all put a pause on Johnson and Johnson. The FDA ain't gonna say stop using it, cause that mean that FDA lets them doing bullshit go through the system. Cause you know, about a month and a half, 2 months ago, the FDA gave Johnson Johnson all clear to be the emergency vaccine use. So the FDA said, hey, stop using this, take this off the shelf. They're gonna have to answer to how in the hell y'all didn't catch this. But nope, the FDA and the CDC said, I'd like to put a pause to this. Pause it. I recommend you. I'm not telling y'all not to issue out the vaccine, but you might want to stop issuing out the vaccine. I know in my home state of Georgia, they taking that junk off the shelf. They're like, nah, we ain't using this junk no more. I don't know what about Alabama. I don't know. People really in Alabama, they really ain't taking the vaccine, period. I don't care which one it is. Pfizer or whoever. It's like 25% of Alabamians don't take the darn vaccine shot. And that's very low. And then one doctor on TV said, hey, we stockpile. We got so much medicine to give out. Them people just ain't coming in to get a shot. Don't get me wrong. In Georgia, they ain't rushing to go get no vaccine neither. But I know people hate that person said, I told you so. But I also told y'all back in January of 2020 when the CDC said, come on, y'all ain't got nothing to worry about. What's going on in China, y'all don't have to worry about it. It's just going to pass through. It's going to be over with. And I told y'all, I said, the CDC don't just come out and say, hey, you shouldn't even worry about it. I said, y'all seen this movie before? Anytime they're doing one of them three-letter federal agents tell you don't worry about something, shit about to go down. And that's what happened with that coronavirus. But now, I told y'all last month, I said, Johnson Johnson going through much shit, man. They worry about the lawsuit. They rushed the vaccine out, but they can get back in the green or the black, or whoever you want to talk to, and stock market green. So they want to get back in the green. So the FDA, they fast ass said, hey, Johnson Johnson, they phase 3 is okay, they're good to go. But now, there have been 6 ladies who took, or women who took the vaccine, and they developed blood clot like 6 or 7 days later, a week later. So that's why they're telling y'all, put a pause to it. I'm not a fan of CNN, but when CNN doing something right, I like to play their article. And here go an article for CNN. So jump by 3 minutes long. So here you go.
Reading it now. That is calling for a pause, an immediate pause in the use of the Johnson & Johnson single-dose coronavirus vaccine. This is after 6 recipients in the United States developed a rare disorder involving blood clots within about 2 weeks of the vaccination. Joining us now is Dr. Carl, Associate Dean at Emory University School of Medicine at Grady Health System. This is these adverse side effects of rare blood clotting in 6 women, by the way, ages 18 to 48. 18 to 48, 6 women out of 6.8 million doses administered, Dr. Del Rio. So what's your takeaway here?
Well, thank you, John. I think the first takeaway is that it's a very rare event. I mean, you're talking about 1 per million. And when you give millions of doses of vaccines, you will see events like this that you couldn't see in the clinical trial just because, you didn't have millions of people enrolled. So it probably is related. It's rare, but I want to congratulate the CDC and the FDA.
He said 1 per million. But Johnson & Johnson ain't put out but so many millions of this vaccine. So you got 1 per million. You're going to put out by 6 or 8 million? Come on, people. We don't need to do the math. You just know Johnson & Johnson putting out some darn faulty shit.
For very quickly jumping on it, halting the vaccinations until we know more, and really trying to understand what's going on. I think vaccine safety has always been a priority, and I think this is exactly the right move until we understand what's going on and what's the way forward.
I have a lot of friends who have gotten this vaccine, so I think anyone who has gotten it in the past few weeks want to know what to look out for. Here's what the FDA says. People who've gotten this vaccine in the past few weeks who develop a severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination should contact their healthcare provider. That's what they should do. Does this, though, show, Doctor, causality, right? That's the big question. Is it coincidence or causality, or do they not know yet?
I don't think we know yet. What we know, and we need to understand this further, but we know, for example, there's data coming out primarily from Europe in the AstraZeneca vaccine, which is also a adenovirus vector vaccine, so it may be related to the vector. The adenovirus vector vaccine may have something to do with it.
What does that mean for people? I don't put that in layman speak for us.
Well, let me put it in very simple terms. What it means is that certain types of vaccines, such as the AstraZeneca and the Johnson & Johnson, which use a cold inactivated virus to deliver the spike protein, may be precipitate antibodies against the platelet factor 4, which causes this immune thrombocytopenia and thrombosis.
People, a person. Johnson & Johnson, and that place over there, that it's a place in Europe, they having the same darn problem. But they call them blood clots. So they stopped that. Europe said, hey, they ain't said we recommend you pause. Europe said stop. We don't want this shit no more. And then Johnson & Johnson in the place in Europe did the same technique, and people developing blood clot. I mean, that technique is not working. And the man saying, well, first he said, we don't know, 6 out of every million person, but then he's saying, well, we don't know. Don't get no darn percentage of 6 out of every million person, then you must say we don't know. Because it could be more people. Because they said take up to, 3 weeks, 14 days. Come on, there's more. I just wanted to say that part.
So what it means to people at this point in time is I think you're likely going to be okay. I mean, when you think about a 1 in a million event, that's, you cross the street every day, you have a much higher chance of getting run over by a car. So I think what people need to be is don't freak out. I'll be going on in my life, but I would be very attuned to my.
You got another doctor saying, don't freak out. There's another doctor saying, don't freak out. Then they're using the car as an example. You got a better chance of getting hit by a car. We don't want to get hit by a car. You don't want to develop blood clot for the damn vaccine. I'm saying, got a better chance of getting hit by a car. It's a stupid ass doctor. Because you're a doctor don't mean you're that damn smart. You know your medicine. But you ain't got no common sense, doc.
My body, and if I develop shortness of breath, if I develop leg pain, if I develop a headache, and I'm within 2 to 3 weeks of having had the Johnson & Johnson vaccine, I would immediately notify my healthcare provider.
That doctor said a whole bunch of nothing. You know why that doctor was available to talk? Because that doctor, it don't work for the CDC or the FDA. He ain't no, this doctor wasn't no expert into that vaccine. They just grabbed the doctor who was available, who answered the call, got a little credential. Cause we all know. We all know that. They're different doctors for different problems. And this doctor is not an expert in vaccine. As a matter of fact, there's not too many experts in the vaccine creation. So he was just giving you numbers like they always do, like saying 1 in every 5 person gonna get herpes, but they never said who that one person. You can just throw numbers out there. You don't know. Maybe 3 out of those 5 people got herpes. Then they're gonna debunk that. Oh shoot, it's more like 75% instead of 25%. Johnson & Johnson. I ain't saying I'm an expert. I ain't saying I can read. I can see the future. I ain't saying I'm in the top 340 million smartest person in the United States. I'm not saying that. But I am saying all you gotta do is look at the track record. Johnson & Johnson track record is not great. Johnson & Johnson ain't had a good track record since they got sued. They're still working on that lawsuit. And if they find out this is an error from Johnson & Johnson, something they did, there's a good chance that Johnson & Johnson is going to get sued again. 6 people, same problem. And then more people don't talk the shot. Because I was looking at the news on yesterday, and this doctor in Columbus, Georgia was saying a lot of people were hearing, they were asking the doctor, say, hey, so what kind of shot, what kind of vaccine is here right here? She said, they told them it was Johnson & Johnson. They said the people got up and left out the doctor office. They said they're not going to take the Johnson & Johnson. Told y'all the money go, people. Y'all, I ain't telling y'all to listen to me, but you might need to put your ear to the door and just get some of the information I'm telling you. Because blood clots are deadly, people. The blood clots are deadly. And this vaccine got passed through by the FDA. Cause I seen that, I was gonna go ahead and try to jump into that Johnson & Johnson doing buy some stock in Johnson & Johnson. But I said, hell no, I ain't fooling with Johnson & Johnson people. I said, nope, that's how bad it was. But when I got my vaccine, I got to go get another one on the 26th. But when I got my vaccine, I made sure it was on Johnson & Johnson. Because I told y'all they're doing video a month ago. I said, I ain't fooling with Johnson & Johnson. I would have drove somewhere else in Alabama or somewhere. I wasn't going to get no Johnson & Johnson shit. Johnson & Johnson. When you got a reputation of killing people, you ain't really stick nothing in my arm came from that company. And the people who did get it, hey, I hope y'all don't develop blood clots. Y'all go see anybody. You get the little symptom. You get a headache. I don't care if it's a damn hungry headache. Man, you go to the doctor and say, hey, I received that Johnson & Johnson vaccine. Tell you get a leg cramp. Go to Johnson & Johnson. Go to that doctor and say, hey, I received that Johnson & Johnson vaccine. I need y'all to check on me. Because you don't want that blood clot to get to your heart. Man, might don't wake up that night. Or in the morning, you might don't wake up, or might have a massive heart attack from the blood clot. So, that's what I'm saying. You feel any little symptoms, say Johnson & Johnson. I took that Johnson & Johnson vaccine. Y'all need to look at me. That darn place said, well, if we're not equipped, go to somewhere else. Don't just stop there. Cause we don't see on the internet how some hospitals say we can't treat you because you got this, or you ain't got no insurance, and people don't die on the hospital floor because they want to treat them. Or they'll take them at that saying, ain't nothing wrong with you. Your blood pressure okay. Seen it. You've seen the articles about it. So I know a lot of people don't like going to the doctor. I don't mind going to the doctor. Shit. I don't mind it. Every precaution the doctor done told me to take, I'm doing it. I love sweets. But the doctor said, you keep on getting sweets, you're going to have to get on insulin. Cut sweets out. Yeah. I see my mom passed away from drinking alcohol. Stop drinking alcohol. Check it out. Tell you, anything that trying to do this 48-year-old body harm, I'm stopping. Quick. Fast in a hurry. I'm stopping. Bump that. I ain't trying to take that risk. I know I'm one of them rare person about who will listen to the doctor and stop. They told my mom and told people close to me, say, hey, you need to do better, and take better care of yourself. And some people just like, I'll be all right. That doctor don't know what you're talking about. Tell you, gotta listen sometime. But this doctor who was just on here talking about the vaccine, this fool is not he wasn't no expert in vaccine. So I know he said a lot of doing technical stuff, like the lady said, putting it in simple terms. When he put it in simple terms, he like, well, we don't know yet. He used all the words that he was taught in medical school and all that kind of stuff, and then put it in simple terms. We don't know. We don't know how it fit. It just 6 out of 100. 6 out of every million person. But the more people don't take it, so they within that they ain't even went past the done 3 weeks or haven't got a exam to see that they got blood clot from Johnson & Johnson. But you got people saying, but that doctor said, well, don't worry about it. Tell you, never listen to a doctor who said don't worry about it. If the doctor tell you don't worry about it, you need to change doctor. Because that joker, that's a bad doctor. He's a bad doctor. The doctor worked at Emory Grady Hospital in Atlanta, Georgia, who were on CNN. You gave some terrible advice today. It was terrible. You should be ashamed of yourself. Johnson & Johnson, people, stop using Johnson & Johnson products. Stop using it. Google, see all the products that Johnson & Johnson make, Google that shit and stop using Johnson & Johnson. Because they have proven that they take shortcuts. They are proven to have killed people from using their products. Johnson & Johnson is not a good company. Just say like that. Johnson & Johnson is not a good company. I wouldn't use Johnson & Johnson. I don't even want to use their lotion. I want to use shit that say Johnson & Johnson. Like I said a month ago, you got 2 Johnsons in the room, I'm getting out. That's too many Johnsons. Hey, put on Johnson & Johnson. Hey, thank you for watching the video. When the FDA and the CDC come out and said, put a pause from using this. Same thing I told y'all last year about the coronavirus. But when they said you need to pause from using this product, they mean it's something is serious wrong with that shit. They don't want y'all to panic. They don't want y'all like, oh shit, I took the Johnson & Johnson. Do it, people. Said, oh shit, I took that Johnson & Johnson. Make Johnson & Johnson be a negative word, people. Make it be a negative word. Hey, thank you for watching the video. If you haven't subscribed, go ahead and subscribe. Come on. I'm begging y'all. Go ahead and subscribe. I'm just a poor man. Just got thing to say. And I'm glad y'all here to listen to it. I hope y'all have a great day. Take care. Once again, happy birthday to my daughter, 18 years old. And I'll talk to y'all later. Hey, drink that water, people.